Good afternoon, and welcome to the Amazing Charts webinar that will focus on MACRA and MIPS for 2017. My name is Chris Tremblay, and I'm the Director of Product Strategy here at Amazing Charts. We've been focused on all of the compliance programs that affect you for a number of years, and we're happy to share what we know about the coming programs that are starting in 2017 and how they might affect your practice. First, we're going to cover the basics of MACRA and MIPS and describe what those programs are. We'll talk a little bit about what you would need to do to participate successfully. Give you some items to consider as you're making your choices around participation in MIPS for 2017. Provide you with some resources that you can peruse after this webinar and share with others in your office. And at the end of the webinar, we'll conduct a live Q&A session based on your questions that come up during this webinar. Feel free to ask us a question online. We'll collect those and deal with as many as we can in the live section. After the webinar is over, we will publish a recorded version of this session. So if some of your colleagues were not able to make today's call, or you'd simply like to share the information more broadly across your network, you can feel free to do that. We'll address all questions that come through in that follow-up email as well. So thank you for joining, and let's get started. You may be asking yourself, really? More regulation, new programs, they're changing things again? We know how you feel. There's a lot of information to get through, even though, and most of it is newly published and evolving. So it's really hard to know where to start and what the end results will be. But that's why we're here. We're here to help you. Today we expect that you will come away with an understanding of the requirements of the new CMS Quality Payment Program, that is, or the QPP, which is the newest acronym from CMS for the MACRA program structure, and explain the options so that you can decide what path best suits you and your practice. So what is MACRA? MACRA is an acronym for the Medicare Access and CHIP Reauthorization Act of 2015. In 2015, CMS and the government repealed the SGR, that was the Sustainable Growth Rate Reimbursement Formula that determines Medicare rates on an ongoing basis, and has now replaced it with the MACRA Quality Payment Program, or the QPP. The Act aims to pay doctors based on positive patient outcomes instead of volumes of care or fee-for-service. It expects to reduce the administrative burden on physician practices around tracking and reporting, and allow physicians to focus on care improvement, ultimately to promote the adoption of value-based care over fee-for-service in the long run. CMS expects that 600,000 Part B clinicians will be subject to MIPS, and they'll be paid under a program called MIPS, or the other option is called an APM, or alternate payment model. Today's session, we're going to focus on MIPS, as we think that's where the majority of the Amazing Charts user base will be participating. But you can find more detailed information about alternate payment models on our website, and opportunities to learn more about ACOs, CPC Plus, Medicare Shared Savings Program, and others that comprise the APM track. So today's focus is MIPS, or the Merit-Based Incentive Payment System. MIPS aims to combine parts of PQRS, meaningful use, the value-based payment modifier program, into a single system which will measure 4 areas of your practice: quality, resource use or cost, improvement activities, and advancing care information. We'll go deeper into each of these categories during today's session, but it's pertinent to know that each category will be worth a certain amount of points that will contribute to a total score and determine what you will receive in terms of an incentive payment or a penalty in the years to come. So some new acronyms. These are always fun. Under MACRA, we now have a new set of terminology to learn. ACI is the replacement of the Meaningful Use Program with a category under MIPS called Advancing Care Information. APMs, we just mentioned, alternate payment models, are risk-based payment arrangements that you might enter into over time that would take you out of the MIPS program. An EC is what's formerly known as an EP, or eligible clinician under MIPS. And for the beginning of the program, they include physicians, NPs, PAs, and other qualifying clinicians within the practice. In years to come, that list will expand to include physical therapy, behavioral health providers, and a host of others. QPP is the new MACRA acronym for Quality Payment Program. And CPS is your MIPS score, or the methodology that will be used to determine a composite performance score that will, in the end, determine your reimbursement. MIPS timelines. So what you're looking at here is a period of years extending from 2016 and forward, where the programs that exist today will collapse and merge into MIPS. So let's take a look at that. 2016, or this year, is the last year that you would be expected to participate as a Medicare Part B clinician in Meaningful Use, PQRS, or the value-based modifier. 2017 would be the first performance or reporting year for the MIPS program. 2018 is the last year that the old programs will impact your payment structure under Medicare. And 2019 will be the first year where MIPS methodology will be applied to determine payments. Each year going forward, the percentage impact to your Medicare payment, whether positive or negative, will increase. So for the first year, the 2019 payment year, you will see a +4 to -4 range of incentives and penalties, increasing to 5, 7, and 9% out to year 2022. The MIPS program does not have a defined end, so we expect to learn more as the program evolves about the shifting payment structures. The timeline at the bottom really talks about the next year or two and what activities you might undertake as you're transitioning to the new payment program. So we're in November of 2016. Beginning in January of 2017, you'll be thinking about tracking for the MIPS program. Towards the summer Q4 of 2017, Amazing Charts expects to be offering the certified solution under the ONC. The newly certified version will be available then. You would be able to upgrade your software between that time and the following spring, and you would report using that new version, version 10 of Amazing Charts, in 2018 for your 2017 metrics. Similar to the MU program, you'll have until the end of the first quarter of the following year to submit your reporting, and we'll talk a little bit more about your reporting options a little bit later in this session. During 2018, Medicare will give you some feedback about your performance as related to your peers, and set the stage for the adjustments you may receive in 2019. So what do you need to do? Well, 2017 has been earmarked as a transition year, and many of the requirements for the new program have been scaled back to encourage all providers who qualify to participate at the level to which they feel comfortable. As an Amazing Charts user, you have many of the tools in your hands now to be able to successfully participate in this program, and we'll show you how. So for today, we put together a little checklist of to-dos. We'll ask you to determine your eligibility for the program. We think most, if not all of you, already qualify to participate. And we'll jump into some details about the choices you have about which path to take for 2017. Later on in 2017, you can think about specific measures that you're going to submit, and then worry about your reporting method and your submission method down the line. So who is eligible? A couple of questions. Are you in your first year of Medicare Part B participation? Do you have Medicare charges that are less than or equal to $30,000 in a calendar year? Or do you provide care for 100 or fewer Medicare patients? If you answered yes to any of these questions, you are not eligible. All other clinicians, practitioners are eligible and will be subject to MIPS penalties for not participating and incentives for participation. So let's take a look at your options. As we said, you have the choice to not participate. In that case, you would do nothing, report nothing for the 2017 calendar year, and you can expect that 4% will be deducted from your Medicare payments in 2019. The simplest path to participation is what CMS is calling the test path, and that would mean that you would submit a minimal amount of information, one quality measure, or one improvement activity, or the base measures for advancing care information for as long of a period as you like for quality measures, 90-day attestation period for ACI, and your Medicare payment will stay flat. You won't receive an incentive and you won't receive a penalty. That's the minimum level of participation to avoid any negative adjustment. Partial participation raises the bar a bit, but only to 2 quality measures, 2 improvement activities, and the 4 required base measures for a 90-day period. That level of participation could modestly increase your Medicare payment. We'll take a look at what we think those thresholds are a little bit further in this discussion. Full participation means you would report on as much as you possibly can across all of the areas of the program for up to a full year, and that would, of course, give you the highest chance of increasing your Medicare payment. And in 2019, the maximum increase you could see is 4%. Again, we'll review what the projections are for the 2019 payment year to see if this is achievable. So let's put it together. As an Amazing Charts user and potentially a meaningful use participant, you are already familiar with the tools and the metrics that are required around this advancing care information category. At minimum, in order to receive 50 points, which is half of the advancing care score, you would perform a security risk analysis in your practice, which I'm sure you're doing annually. You would e-prescribe for at least one patient during the reporting period. You would provide access for patients to view, download, and transmit their medical history, also for one patient for the reporting period, and for at least one patient you would send a summary of care. Additional measures count towards a performance score or the other 50 points that can be earned along with bonus points. And those involve using tools that are also already included with Amazing Charts that you're probably using every day. You would send a secure message to a patient or reply to a patient message securely. You would be performing medication reconciliation on patients as part of your clinical process. You would engage in public health reporting, at least immunizations, if not others that are allowed. You would be distributing patient education, contextual to a patient's problem at the time of visit. And of course, you'd continue to use your currently certified EHR and the newly certified EHR next year to complete your activities. This category should be very easy to meet for all Amazing Charts users. We're happy to help guide you through how to make these choices. On our next slide is a complete list of the options available to you under the Advancing Care Information objective. And you can see that everything on this list is something you can do with Amazing Charts today, except the syndromic surveillance reporting category. So easy to earn the base score, easy to earn scores beyond that. So very quickly, security risk analysis will include this information in the deck for you so you can read it in detail. You've done this as part of meaningful use. E-prescribing, you also need to make sure you're using drug formulary and you're transmitting prescriptions electronically with the tools in our Amazing Chart solution. Health information exchange, again, is the transmission of a summary of care to another clinician and providing patient access, again, online in a timely manner so that a patient can download that record and transmit it to a third party. Practice improvement activities, another chunk of this pie that we will review today, comprises 15% of the total score. And again, knowing the kinds of practices that you run today, many of these improvement activities that are listed in the rule are probably things that you're already doing. I should mention that for both of these categories, advancing care information and improvement activities, you will be required to attest that you have done these things in your practice. You will not be required to track numerator, denominator metrics and provide hard copy reports from the EHR, you would be attesting that these are things that you're doing in your practice today. Improvement activities have a value assigned to them. The total score for this is 60 points, and it can be comprised of both high weight and medium weight activities as defined by CMS. The point values are assigned based on the level of effort that's involved to do them. You must attest that you've done these things for a 90-day period during 2017 to receive full credit. And there are things like care coordination, offering telemedicine within your practice. That can just be phone-based visits. Population health tools where you're identifying care gaps within your patient panel and anticipating folks that need to be seen in your office for other wellness and preventative services based on their risk. It includes things like expanded practice access, the ability to reach a provider after hours or perhaps get a same-day appointment. Those things qualify as part of practice improvement activities. Beneficiary engagement includes things like actively making a care plan with goals that you're tracking within your patient base, and having an emergency preparedness and response plan as part of your business in your office. So again, Amazing Charts thinks that these things are achievable based on what we know about the way that you practice medicine. And you should be able to tick these boxes fairly easily. So let's take a look at the quality slice. You can see it is the biggest slice of the pie for 2017. I'll just explain that quality was intended to be a little less weighty in the 2017 picture, and resource use or cost was to be included. Resource use has been excluded for the 2017 cycle, and quality has increased to 60% of the score. Now, quality are things that you measured under meaningful use, under the PQRS program, and under other programs you may be participating in with your commercial payers. There is a very long list of available quality measures that you can adopt and report on in your practice. We've included some common family practitioner quality measures and specialty quality measures for your review in this document. What's pertinent to know is that you are expected over time to report up to 6 measures, one being an outcome measure, and they can be across any combination of quality domains. Each measure of the 6 is assigned up to 10 points, and 10 points is based on your performance as compared to others. We'll get deeper into that as we move forward. So let's go back to the pick your path choices. First we said if you just want to avoid a negative adjustment, choose the test path. That means you'll do one of these things listed on the slide, attest that you've done it, and move on. That keeps you at a zero-sum game for your 2019 reimbursements. Partial participation gets a little trickier. Again, you can do as many or any combination of these category minimums as you would like, or just stick with one track. As you can see, it's listed as quality or improvement activities or advancing care information. Again, given what you've seen in this presentation, it's achievable to be doing at least the Advancing Care Information attestations along with some quality and improvement activities as well. So any combination of reporting across these will suffice. And then full participation brings you into the realm where you'd be signing up to do all of these activities, including the full range of quality reporting on the 6 measures or a single measure set, and that can be focused on your specialty if you choose. Improvement activities, 2 or more of those. And under the Advancing Care category, the 4 base measures plus the performance and bonus measures. Obviously, to achieve the highest possible score, this would be the path that you would take, and you would likely earn a positive adjustment up to the threshold that's allowed for 2019. So some things to consider as you're making a decision about your path for next year. Here's a little more detail on the scoring methodology that goes into this calculation of the CPS, or the composite score. As you see, I crossed out the resource use component of the calculation because it will not count in 2017. Therefore, the quality point score has gone up, and that represents essentially 60% of the 100 points that could be achieved. Practice improvement has a range of 0 to 15 points, and advancing care 0 to 25 points. So you will be measured on a 100-point scale for each of these areas. And then your score added together across each area will be some subset of that 100 points. It's expected that anyone who achieves over 70 points, so between 3 points and 70 points, is expected to be the average across the nation, and over 70 points would indicate exceptional performance. So earning 3 points, that minimum path that we talked about, report 1 measure or 1 activity, results in the 0 payment adjustment. What's really important to understand in 2017 is that it is a transition year or a benchmarking year, particularly for the quality category. So what does that mean? Well, much like it was in school, you're going to be graded on a curve based on where your peers sit across these quality domains. So this is why it's really difficult to ascertain what level of incentive or positive payment adjustment one might receive, because the benchmark has not been established. So how does this work? The points will be based on the percentile performance for each measure relative to national peer benchmarks. And bonus points will be available based on whether you choose high priority measures and other criteria. In 2018, CMS will publish the statistics that came in 2017, and you will understand where you fall in that quality sum. So, for an example, if a family health practice decided to report on the measure for breast cancer screening, for example, and submit numbers that put that practice, say, in the 90th percentile of performance for breast cancer screening for their panel. If all other providers in the nation score nearly in the 90th percentile, then that will become the benchmark for which incentives will be calculated for above the 90th percentile or below the 90th percentile. So even though your individual performance may really be stellar, you won't really understand the adjustments until you are compared with others. So the bottom line is, the more you do while participating in the program, the more you increase your chances of a positive adjustment. But we can't quite read the tea leaves yet as to how those adjustments are going to fall out over time. So here's a quick graph that represents the projections for the 2017 performance year. Now keep in mind, the threshold for the minimum number of points has been lowered significantly. So 3 points minimum, you avoid the payment adjustment. This will change in future years. But for this year, it's expected with that low bar that there will be a slow sort of climb in the points rankings between 3 and 70, and that the average practice could see something in around the 1% range of positive adjustments, even for a score close to 70. Above 70 would be difficult to achieve, and most practices would not see our performance bonus in the 4% range, just given the way that the program is structured for the 2017 reporting year. So let's look ahead to 2018. You'll need to upgrade your Amazing Charts software to the 2015 certified version. We are actively working with the ONC certification body. We have our testing dates locked and loaded and are looking forward to releasing that in late Q2, early Q3 of 2018. You are not under the gun to upgrade on the first day. You have a certified solution that you're using today with Amazing Charts. You can continue to capture all of the relevant metrics, participate in the ACI category, participate in practice improvement, all with the Amazing Charts version that you have today. The reason why you'll upgrade to version 10 is to get access to updated quality measures, to get access to additional tools that will be added to the program to help make MIPS participation easier. You'll see an upgrade to CCDA and other tools that are already included with Amazing Charts today, and we'll be publishing the dates when that will be available for your adoption. Keep in mind that 2017 is the transition year, and requirements will change. As I mentioned earlier, for 2018, we can expect that resource use or the cost category will apply. That won't mean any change to your technology or to the things you report as a provider. The cost and resource category will be calculated based on the claims that CMS is processing on behalf of your patient panel, and we'll look at the total cost per beneficiary. Will be something that you will not have to calculate it or submit yourself. The minimum reporting periods may likely change. For advancing care information, they've said for 2018 it will still be a 3-month or 90-day attestation period, but the thresholds and reporting periods for quality may in fact change. As you saw earlier, the positive and negative adjustment amounts will vary. It will go up to 5% in the 2018 reporting period, and it's quite possible that the category weights will change. Over time, quality is expected to be reduced, and other pieces of the pie may get larger as a result. So as I mentioned, you can use your current version in 2017. We recommend that you upgrade when that's available. If you're not on our latest version, version 9, give us a call. There are lots of great new features there that you can take advantage of above and beyond MIPS participation. Once you are upgraded, your 2017 measures can be reported, and that will happen in the first quarter of 2018. During the year, you'll continue to manage your patient's care using our clinical decision support tools and reminders and all of the processes that you use today to make sure you're providing quality care to your patients. We strongly advise that if you are considering full participation for the year 2017 and you have a need for tracking complex or specialty quality measures, that you select a certified reporting registry. That would be another third party that we would help engage for you. We would make sure that the data that's required for them to calculate your quality measures is made available from Amazing Charts. We have a number of registry solutions that we work with today. Our recommendation would be to contact your local medical society around which registries they may recommend, or give us a call and we can guide you on the ones that we work with in the marketplace. So where can you get more information? Well, certainly please log on to amazingcharts.com. Under our support tab, we have a MACRA MIPS area with just tons of additional information, certainly a lot more than we were able to cover today, including frequently asked questions, resource links, publications, checklists, really a gamut of information that you could find very helpful to educate yourself and your staff. CMS has put together a really great website for this initiative called the QPP site, and also has a lot of customized information that you can find on that site. They also take questions from users and vendors and other people in the marketplace. I'm not sure how long that will continue now that our administrations are changing, but certainly under Mr. Slavitt, he has done a really stellar job at supporting questions surrounding this program. So I would strongly encourage you to go straight to their website to learn more about your options. And for the future, we're planning to cover a number of topics around this area via future webinars, including how to really maximize your participation and going deep into the scoring methodology to help you understand a little bit more about how this is all going to add up. We'll provide a session on using AC for a lot of these activities and explain the array of options that you'll have for reporting. Very little of it in the future is EHR-based, and much of it can be done self-service with CMS. We would love for you to continue to submit questions to us through our client services organization and other channels that we make available to you, and we are happy to guide you further as you try to digest all of this very complex information. So we do have a polling question that we'd like you to answer. We know that you just learned about these paths, but if you had to pick a path right now, which path sounds best for your practice. We just ask that you take a moment to answer that poll question now. We're not going to publish the results on the screen, but we will publish the results in our follow-up communication to you about this webinar.
If you would like to submit your questions now, we can record them all here, and then we'll follow up individually with you after the webinar has concluded. And also, as a reminder, we will be sending out a copy of the recording and the slides as well. Will payments in 2019 be based on Medicare volume and charges of the reporting year, 2017, or will they be in 2019?
The 2019 payment adjustments will be based on the information that's submitted for the 2017 reporting year. And following that, the 2018 reporting year will affect the 2020 payment adjustments. So there's a 24-month lag between the reporting and the effect on Medicare payments.
Great, thank you. And I think we have time for a couple more, and then we can follow up individually on the remaining questions. One good question, do we have to register separately for the MIPS, or will previous MU registration be sufficient?
Not quite sure what's meant by registration, but the Meaningful Use Program essentially for Part B submitters no longer applies after the end of 2016. So the government will be expecting that if you have more than 100 Medicare patients and are submitting more than $30,000 annually in Medicare charges, that you will be participating in this program. So there's no specific enrollment required. Your eligibility would be determined by those thresholds.
Great, and then we'll take one final question. The question is, theoretically speaking, should all ECs achieve maximum results? How would the readjustments be determined at that point?
Theoretically, that's a good question. I think there's some differing opinions on how providers will fare in this new world of MIPS. So we didn't get into much detail around the reporting options, which will be a future webinar. But on our website, you can find more information about whether or not you want to submit as an individual MIPS clinician reporter, or if you want to submit as part of a group. And groups are now defined as 2 or more providers. So in the scheme of things, it may make sense, and your numbers may look better if you're able to combine your patient panel with your partner's patient panel and measure quality across a larger number of patients. However, that may not be the case, depending on how diligent the quality metrics are being tracked within your group as a whole. So an individual clinician certainly could have some outliers in their patient panel that could negatively affect how their performance will fare in the long run, but certainly this is something you keep an eye on, particularly in the aspect of quality, as 2017 is going to determine national benchmarks and what that minimum threshold will be for each quality measure that would determine whether or not you're in a position to receive an incentive.
Great, thank you. Okay, so I think that's most of the main questions we have. If you did submit a question that we weren't able to address, we will follow up individually, or as Chris mentioned, please don't hesitate to reach out to us. You can either visit our website or reach out to our client services team. And as a reminder, we will be sending out the slides and a recording of this presentation to everyone who registered. So thank you for your time today, and we look forward to seeing you on another webinar in the future.